Good evening, guys. Welcome to our video today. Those are our beautiful flowers you can see there. That is the beautiful, and that's the beauty of Africa. Hope you enjoy the video today. Yes, those are very our ornamental flowers, as you can see. So enjoy the today's video is going to be very nice, as you're going to see. Welcome. The time in Africa is now 6 p.m. The sun is almost setting, as I'm going to show you guys. Welcome to our video, guys. When it is 6 p.m. in Africa, we check here the sun sets here in at around 6 or 7 p.m. as we are going to see. But I want to show you the beautiful setting of the sun to the other side there. The sun is almost setting to the other side. That's the beautiful sun to the other side. And on this side, I'm going to show you those are our beautiful vegetables, as we are going to see. So have a look there. Those are our beautiful or very nutritious vegetables, as you can see there. Those are, we call them munderema here in Africa. I don't know how you call them in your own language. So I hope you enjoy we enjoy the view as exhibited there. So guys, I want to welcome you to today's video, and I hope you're going to enjoy it. Some insect here is disturbing me. Yeah, so and actually here we have our beautiful sugarcane there. As you can see, that's our beautiful sugarcane. You can have a look there and check. Very succulent there. That is the beauty of Africa, as you can see, guys. So yeah, that's a sugarcane there. Taking a closer shot over the same, which I've never shown you there. Those are a beautiful and also very succulent sugarcane, as you can see. Don't know how you call them in your own language, but that is in Africa, and that is our sugarcane there, as you have seen there. So the sun is actually going to set. That's the beautiful sun on the on the on the on the trees there, on the vegetation there, as you can see. So that's how we enjoy. That's how we enjoy it here in Africa. So as I said, the time now is around 6:05. Actually, it is 6:05 p.m. here in Africa. So it's a good evening. And today I want us to share something very special about uh, about our life. Something which really is very interesting. I'm going through a fence here to go to the other side. Such kind of fences are very common here in Africa, as you can see. So I went through that space to go to come to this other side here. And also I want to show you our famous pawpaw here, as you can see. So that is a beautiful pawpaw there, pawpaw plant. Yeah, very slim, but it has some fruits here, as you can see. And this one is almost maturing here, as you can take a closer look. Yeah, those are our pawpaws there, and that's how they look from above. So these are beautiful pawpaws here, very succulent and also very organic here in Africa. Of course, our beautiful guava tree there. Actually, I want to show you, it's very small there. This one here, but when you come and take a closer look at it, as you can see from above there, it has very beautiful flowers, leaves there, as you can see. Yes, and it is almost it has some fruits here, so you can check a look there. Yeah, actually, when I check the shot from this other side here, you can see here. So we have some fruits here, as you can check there. Yeah, fruits there. Yeah. So those are the beauty of the fruits here in Africa. And of course, our famous vegetables here, as you can see. You can take a closer look at it. That is sukuma wiki, very common in Africa. Sukuma wiki, as I always tell you, it means pushing a week, and that is how we always push it here in Africa. So today we're going to talk about the nursing profession. I'm going to bring a new perspective over the same, like we always do, and we bring that is the beautiful environment of Africa, as you can see. So you can take around and see how it looks. Actually, I want to take you to some of you are asking me about the gooseberries, and that is how they look also from above, and also taking a closer look also inside. So those are our beautiful gooseberries. They are natural, and we don't add any chemicals there. We take them naturally. That's one of the plants we have here, and actually I'm trying to eat. That's how they look, as you can see there. So that's what we take here in Africa. We eat like the way I've done it. So today we're, we're going to talk about the nursing profession, as we are going to see shortly. So today I want to bring all the same a very interesting perspective on the nursing. I like the way the view there, as you can see. It really looks very nice. Sunset in Africa. That's how our sun is going to set here in Africa, and I want to show you like from to the other side there. That's where the sun is going. That's the west part of it, of from here where the sun is going to set to. So I want to talk about the nursing profession in a very different way, and also bring you a very interesting kind of perspective over the same. So when we talk about the nursing profession, I want to talk about something very important on when you want to become a nurse. But today I want to call the topic of this video, don't become a nurse if you have these things. Yeah, don't become a nurse if you have these things. One, for example, for those who want to be nurses, especially the bedside nurses. The bedside nursing means somebody who wants to be a nurse and take care of the patient in an hospital setting, and take care of the patients in the inpatient part of it. So if you want to be on the like bedside nursing, these are the things. Don't become one for those who have not become one. And if you have chosen to do the nursing perspective of it, maybe you can change to other things, but not nursing, because it will not be interesting. Actually, this profession of nursing should be enjoyed by those who are doing it, but due to some reasons, some people get a very big challenge on doing it. So when we talk about the things which a nurse should, or the things which as a nurse should not, don't become a nurse if you have these things, as I'm going to share with you. So one of them is if you hate bodily fluids, and that is if you see blood, you see the vomiters, and you feel like, wow, I'm nauseated so much. So that's one reason we should make you not to become that nurse, because most of the time you will be seeing such kind of things from the patients. If you had bodily fluids, those are the blood most of the time, vomiters. Sometimes you can find that other patients also pass through, and you are the one to take care of such kind of patients, especially when you are on the bedside nursing. If those things nauseate you, yeah, that's one indication that you should not become a nurse. Another thing is if you hate caring for others. So if you find it very difficult to care for other people, because naturally we have people who can't take care of other people, that's one of the things which can make you not that's one indication that you should not become a nurse. Another very another very important thing, if you feel that you are not sympathetic, there are people if you are a person who doesn't feel remorseful of other people, if you are a person who feels that you can't take care of other people's interests and be sympathetic over the same, so and care for them, if you find that you are not sympathetic enough, it is not one indication that you should not become that nurse, especially the bedside nurse. Another thing, if you don't have interest to learn new things, because as we find out, medicine is a very dynamic kind of profession, and nursing being a branch of the also medicine, things change, practices change, so that we improve the way we take care of our patients, or the way the nurse takes care of the patient. So if you are not interested in to learn about human body, and also learn how the body works, and also learn about the new medicine, and also how new procedures which should be done by the nurses and how they should be done. So if you are rigid that you can't learn new things, you are not open to learn new things and also learn more about human body, and if you are not open-minded, so it's one of the indications that you should not be that nurse. So another thing which is very important, uh, if you can't if you are not you are a person who cannot multitask in any way, especially at the working place. So because you always find that we as nurses always multitask. You may find that you are allocated to a certain patient, or you are doing something on the patient, but you 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 also work at the same time. Maybe you also need to administer some drugs to that patient, and also because those things are not most of the time they are not readily available for you, you need to be a person who can multitask. So sometimes the nurses can take the sample of the patient, instead of waiting for the lab person to come and take the blood for testing. The nurse can take initiative of taking those samples to the next station, so that the results come out, so that they assist in the care, and also in the admission, and also in the care of the patient as appropriate. So the nurse is very important to learn on how to multitask. Sometimes you may be the porter. The porter is the person who carries the patients, or who wheels the patient from one place to another. So you may get that at some point you don't have the porter. So you have to act as the porter with the other team to ferry the patient to the next place, because you want quality for your patient. So it's very important to learn on how to work to multitask. And also you may be doing something for a patient, for one patient, but because also you have that skill of multitasking, the other patient may be changing the condition, and you are not the one taking care of the patient, but because of your observation, and also the way you can always multitask, you can take care of the interest of the next patient, or you can see someone who is messing up with your patient while taking care of the other one. That is also a form of multitasking, and also learning on how to take care of those patients. So if you can't multitask, my brother, my sister, is an indication that you can't be a good nurse. Another thing which is very important is about if you can't work with others. You find that especially in the hospital, and also in taking care of the patients, you have to learn on how to work with others, which is very important, because working with others is the because this profession, especially the nursing, you work with many people, and also those people are the ones who assist in taking care of the interest of the patient, and also your interest as a nurse. So most of the time you work with the physicians, you work with the lab people, you work with with the physiotherapists, you work with the cleaners, you work with the theater team, theater technicians, and everyone. So you have to learn on how to work with everyone. So in case you have a problem, like if the patient is on a physician, you need to call back the physician. and learn on how to communicate with him or her on the continuity of the patient's care, so that the patient gets the kind of quality care. So teamwork, you should learn on how to work with others, even the working with other nurses, because also the team as nurses, they are trained from the school that they should learn on how to work as a team, because also team nursing is one of the theme which is shared in the studies of the nurses, so that they learn on how to take care of the patients and also know how to involve everyone, because we have what you call a medical team. We have the team which takes care of the patients, which involves the doctor, that's the physician, involves the nurse, involves the lab technician, or all the lab technologists to take care of the patients. It involves the pharmacy person, that's the pharmacist or the pharmacy technician. It involves the students who are also the medical students who are in the hospital working there, or doing something, or learning from the others for mentorship and everything. So those are the things which a nurse should have on how to work with everyone, from those students, the medical students who are there, to the cleaners, to the mortuary attendants, and also the pathologists, to the administrators of the hospital, so that it makes also the work very easier for them. So guys, those are my observations on how to improve this profession. And if you find it very difficult, especially those who are going to the field, and those who have even the kids, the parents, I know there are parents who are watching this and they want to take the kids to the nursing school, find out and also share with your kids, or if they have that passion, because the five things I've shared, they bring on the passion of that person to work in the hospital setting, and also help the patients appropriately, so that they may be taken care of the way it is needed, and also bring on the best for this work of nursing. So guys, welcome, and welcome for another video. So thank you very much. And also I want to encourage those of us who have not subscribed, you can subscribe to our channel. And for those of us who want to support the channel, the details of the channel are shared there. And also share your ideas how to make the channel more interesting for you, and also bring the best for you, because the channel is for you. It's only not only for me, but I want to bring you the best, so that we can take this channel to the next level. We're in the journey to 10,000 subscribers. So guys, support the channel, kindly subscribe. Most of us are watching this channel, but you have not subscribed. Kindly, I want to request you that you subscribe to the channel, and also share with that friend somewhere, so that he or she joins us in the subscribers, so that as I upload the videos, we can be watching more. And kindly click that notification bell, so that when a new video is uploaded, you can get to know, and also watch it. Kindly also give a nice comment down there, so that we may give you the best, the best that we can from this other side of Africa. It is the village in Africa. Welcome for another one. Thank you guys. Welcome.